Somebody! I've fallen and I can't get up. Help!
Ma'am, are you okay?
No!
What happened?
I fell. There's ice everywhere.
Okay, you just stay here. I want to call 911, okay?
Okay.
All right? Okay.
Ow.
Hello? Yes. I need an ambulance here now, okay? A patient fell on the ground, okay? All right. Okay. They're coming.
Thank you.
Sorry. Hi, my name's Lee. I'm gonna be your nurse today. Could you tell me your name and date of birth?
My name is Marilyn Hughes, and my birthday is January 28th, 1968.
Alright, can I see yours? Okay. And I see that you had a fall. Could you tell me a little bit about that?
Yeah, I was leaving work today, and I guess I wasn't paying enough attention, and there was ice on the ground, and so I slipped and I fell on my left side, my left leg area, and some wonderful lady found me.
Alright, I'm just gonna look at your leg. It's the left, right?
Yes, ma'am.
Okay. And are you in any pain right now?
A little bit.
What would you say it would be on a scale of 0 to 10, with 0 being none at all and 10 being the worst pain you've ever been in?
It's probably like a 6 or a 7.
6 or 7?
Yeah.
Alright, I'm just gonna look at your leg.
Okay.
Just looking at the color. It's consistent throughout. I'm gonna check the temperature.
Ooh, your hands are cold.
Sorry about that. Alright, I'm gonna find your pulse. Does it hurt too bad to move it like that?
Just a little bit.
Alright. Alright, your pulse feels good. Can I get you to move your, wiggle your toes? I don't make you move your hurt leg, but you just wiggle your toes a little bit.
There you go.
Alright, that looks good. And I'll just check this leg for comparison. It's warm, your color looks good. Check this pulse too. Alright, can you wiggle this toes? And can you move this leg for me? Move it up. Alright, that looks good. Alright, Miss Hughes, I'm gonna ask you some questions real quick. Have you had a history of falls before?
Yeah, I've fallen at home before, but it wasn't nothing this serious.
Okay, well, previous falls can increase your risk of future falls. So that could have been a factor that caused this. I see that you're at the age for menopause. Have you went through that yet?
I have.
No. Well, that can cause you to have a greater risk of getting osteoporosis, which is because of your lack of estrogen production through menopause. So that could have been another factor that contributed to this fall this time.
Oh wow, I did not know that.
Right, do you need anything before I leave?
My leg is really hurting bad. Can I get anything for that?
Let me check and see if the doctor's put in anything for that yet. Alright, looks like there is some pain meds ordered, so I can go ahead and give you that while we're waiting on the doctor to come in and talk about your x-ray.
Okay, thank you so much.
You're welcome.
Hey, Miss Hughes. So I'm your doctor, and I just came to show you what happened on your x-ray scans, and like we got them back, and I just want to explain to you what happened.
Okay.
Okay, so basically you have a simple fracture. So that means it doesn't break through the skin, so your bone's not broken through the skin, so that's why it's not bleeding. However, there is a simple fracture line on your bone. So I'm just going to show you, okay?
Okay.
So right here, this is your left tibia, and this is the simple fracture line that's right here. So that's what happened. That's what got fractured.
Okay. So, can it be fixed?
So we're actually going to put a simple cast on you, and it's going to be fiberglass.
Okay.
And this is just going to immobilize it, so that way the bone is actually able to heal properly
Okay.
without being all like flimsy and breaking some more.
Okay, well, one of my concerns right now is work. I really need to go to work, so I mean, I don't do a lot at work, but I do need to be able to move. Am I going to have to be in bed or what?
No, we're actually going to give you crutches. So physical therapy is going to come in here, and they're going to show you how to use crutches and how to walk with your cast along with your crutches, and how to get like upstairs, downstairs, and different things like that. So.
Okay.
Hey, my name's Caroline. I'm from physical therapy. How are you feeling?
Okay.
Well, they told me to come teach you how to use these crutches. I see that you got your cast on. You ready to try to get up and do it?
Yeah, I guess so.
Okay, so we're going to be teaching you 2 different types of ways to use these, and you can pick whichever one is more comfortable for you. The first one is called the 3-point, and what you're going to do, I'll show you. You're going to move these forward with your affected leg, which would be your left one, and you're not going to put any weight. You're going to put all the weight in the crutches, and then you're going to pull this one through like that. And then the other one is the swing through, which is the one you've probably seen before, which is the one where you lift both legs and you go through and you keep all your weight on your unaffected leg. Okay, so you understand both of those and ready to try?
A little bit. Let's try.
Okay. Alright, so we've already had these adjusted for you, so make sure when you're using these that your hands are beside your hips, and you want your elbows to be bent a little bit, but you make sure you don't put them on your armpits. They want to be about 2 inches below, okay?
Okay.
So which one do you want to try first?
I can try the swing through, I think.
Okay, do you remember how to do it?
No, can you explain it to me one more time?
So remember, you need to put the crutches in front of you and lift both feet off the ground. Keep weight on your unaffected leg. There you go. So keep going. Good. Okay. You want to go back this way?
Yeah.
Okay, so now we're going to do the 3-point. Do you remember how to do that one?
I guess. Is it like this?
Not quite. You need to make sure you're moving the affected leg, so your left leg, with the crutches at the same time. But keep more weight in the crutches.
Okay. Oh, no. Okay. Move the crutches with my leg.
Yes, your left leg.
Okay. Like this?
Yes. Good. You can touch that foot to the floor, just don't put weight in it if that helps.
Okay.
There you go.
I think I got it.
Good. So I brought you out here to practice. Did you pick which one you want to use?
Oh, I think I'm like the swing through.
Alright, so let's walk back to your room and I'm going to teach you one more thing before I go, alright?
Okay.
You feeling okay?
I'm a little tired. That's okay.
I'm here. Do you know how to sit down with those?
I don't actually.
I'll teach you. So face me and carefully back up to the bed.
Now put the crutches in one hand and put all your weight on this foot. Now use this hand to touch the bed and now sit down slowly. And the same thing when you get up, you want to do the exact same thing but in reverse. So put them in your affected side so that you don't put any weight in that foot. Does that make sense?
Yeah, so I would get up like this.
Yes. And then, there you go.
Okay.
Good. Do you have any more questions?
No, I think I'm okay.
Okay. Do you need me to get anyone for you?
No, I'm okay.
Okay, well, I'm sure the nurse or doctor will be back in here soon, okay?
All right, thank you so much.
You're welcome.
Good morning, Ms. Hughes. I'm your doctor. I'm back. I'm just going to tell you and explain to you the different complications that can come along with your cast, okay, and the fracture. Okay, so the first thing is there's compartment syndrome. So I'm just going to tell you the signs and symptoms that can occur, and just to look out for these things and report them to your provider or come back to the emergency room. So if you have increased unrelieved pain with like numbness and tingling when you elevate your leg, that could also be signs and symptoms of compartment syndrome. Paralysis, weakness in your leg. If you don't have a pulse, that is a late sign, so you want to come in here as soon as possible. When your muscles are hard and swollen, like if you're feeling around on like your toes or anything like that and it feels really hard, you definitely want to come back and see us. If your blood is getting like pale, you don't see any like redness in there or anything like that, you want to come back and you want to see us again.
Okay.
So there's another thing called fat embolism, so you also want to look out for signs of that. So that's basically when you're having trouble with breathing, if you have a headache, you get confused, or if you feel like chest pain,
Okay.
you want to come back and see us for that, okay?
All right.
Then we also have DVTs, so that's called deep vein thrombosis. This is basically like a blood clot or like a pulmonary embolism, which is a blood clot in your lungs.
Okay.
So if you have like swelling in your legs, like both of your legs or just one, if you have pain and trouble in breathing as well, you want to come back and see us for that. We have this. Okay, so another one is osteomyelitis, so that's the infection of the bone. So that can happen when you get a fracture and it just becomes infected. So that's when you have like constant, like it's pulsing and like in your cast and it just feels like your bone is just pulsing really hard and it's not stopping. So you want to come see us. Also, if you feel like there's redness, swelling, or if you get a fever, that's a sign of the infection as well. So those are just the complications that can come along with having a cast, along with having a fracture. So your nurse is going to come in here and she's going to give you some discharge papers, and I'm going to give you a brochure that explains all the things that we've been talking about, such as the complications, how to use your crutches, how to safely get up and down, and just different things like that. So she's going to come back in here and give you some discharge papers, and that's all.
All right.
Do you need anything?
No.
Okay.
Thank you so much.
You're so welcome.
Hey, Mrs. Hughes, how are you doing?
Okay.
I see that you have your cast now. Are you in any pain right now?
No.
It doesn't
really.
feel, I'm just gonna look at the cast. It's not feeling too tight.
No.
Alright, I'm just gonna check your pulses on here. Alright, and can you wiggle your toes for me? Alright, and you have a good color on your feet. So you said it's not too tight, it's feeling good? Alright. And so I'm just going to tell you a few things about cast care, because is this your first cast?
Yes, it is.
Okay. So I know that casts can be very itchy, but it's very important not to stick things down there when it's itching. So, because they can get stuck down there, they can break the skin, cause infections. So we want to avoid all those types of things. So if you just get a hair dryer and put it on the cool setting and blow it down in there, that can relieve the itching.
Okay.
And also, it's important not to spray any perfumes down there. I know it can be smell a little bad, but that's normal, like a sweaty odor. And when you're taking a shower, it's very important not to get your cast wet. You do have a fiberglass cast, so it is water resistant, but we still want to submerge it fully into water.
Okay.
So if you get a trash bag and just tape it around, and then just make sure you keep your left leg out of the shower or out of the bathtub whenever you do it, then that should work. That should keep that dry.
Okay.
Do you have any other questions about your cast?
Not particularly.
No? Alright. Alright, so I have some discharge papers for you here. It's just telling you a little bit more about your cast care, crutches, kind of an overview of everything we've told you, the signs and symptoms of all the complications that the doctor told you about earlier.
Okay. So when I'm walking with my crutches, I want to make sure that I'm not on my armpits and that my armrests are at my hips. Okay.
Yeah, you want to make sure your weight's on your hands, because it can, if you put the weight all on your armpits, it can cause some nerve damage and other complications.
Oh yeah, we don't want nerve damage. Definitely. And also, I remember I was taught that you just told me not to put any perfume in my, or sprays or lotions in my cast. And also not to scratch with anything in there. Use a hairdryer.
Yeah,
You learn something new every day. A hairdryer. Who would have thought?
Cool setting.
Cool setting on a hairdryer, and then making sure that I wear a plastic or trash bag over my
any
leg,
plastic bag, anything just to keep that cast protected
and
from
to
the
keep
water.
my hurt leg away from like the water in the shower. Okay, and making sure that if I'm any pain when I'm raising my leg, that I come to the doctor. If I can't feel my toes or the coloring of my legs or anything changes, I come see you guys.
Anything like that, and especially pain with passive movement, which is when somebody else moves your extremity for you. So if you have anybody that you're living with, just get them to raise the here, I can show you now, just raising your calves. So I'm just going to do it for you. You want to make sure there's no pain when they do that, because that can be the complication of compartment syndrome, which is a very serious complication.
The doctor just told me about compartment syndrome. Okay, I think I understand everything.
Okay, do you need anything else before I go?
No, I think I'm okay.
Well, good luck with everything. Hope you get better soon.
Thank you so much.
You're welcome.
Thank you guys so much.